Hello there, I've been asked to do a short video for you on wound care, just in case you turn up at your yard to see your beloved horse or pony and they've cut themselves. Obviously if it's really serious you will have to call the vet, but obviously at the moment we're trying to minimise contact, so if we can help you to look after your horse in-house, that's what we're here for. So I'm going to stop the video and show you the products on the shelf, and then there'll be a series of videos, and I'll just explain kind of which ones are best for which problem, issue, situation. The first stage in wound care is to cleanse the wound. Here we've got a couple of products. You've got the iodine spray and then you've got the EquiCleanse. Both are ready to use preparations that you can pour straight onto the wound to cleanse them. You can also use a hose if your horse will let you, or salty water. Normally we have a slightly wider range of products, but we've run out and we hope to have stock soon. So you've also got Hypercare, so if you find that in your tack box or your first aid box, and also Hibiscrub, but that is a hospital hand wash, so if you have any of that you should probably be using it on yourself at the minute. But these are the products that we would recommend that you use just to clean the wound, because if you can get it as clean as possible, then you're minimising the risk for infection. When you're cleaning the wound, try and pour the solution onto the wound under a slight pressure. So if you've got a syringe, that would be the most ideal. The iodine spray has got a spray pump, so that's also very good. You want to be avoiding using cotton wool if you can, because you don't want fibres from the cotton wool to get stuck in the wound and causing a potential problem or risk of infection at a later date. So once you have cleaned your wound, you've then got, well, you don't have to, but it would be ideal if you put something on the wound to protect it from the outside environment. So here we've got a selection of products that you can put on your wound. I'll just talk you through them. You've got the traditional wound powder, which is normally antibacterial and antifungal. That's that product there. That just helps to dry up minor wounds and creates a sort of a scab on the wound. So you've got that, and then moving on, we have got the Vetalintex, the Vetericin and the Dermagel. All these three products are hydrogels, and they are something that you put on the wound, and they create an environment that maximises potential growth of the baby cells, so the epidermal cells. So if you put those on, it creates the environment that is kindest for the wound to heal, quickly. Moving on from these, we've got the wound creams. So you've got all these. So you've got NAF wound cream, Dermaline wound cream, the MSM ointment, and the Cardem Martin wound cream. So we've got these products here. So they create an antibacterial, waterproof membrane barrier, so that you can protect the wound and it does its job underneath. Then moving on from there, you've got the purple spray and the spray on plaster. So the purple spray sort of, is antiseptic and you just spray to very minor wounds and chafing. And then you've got the spray on plaster, which is designed to create a barrier which is fairly difficult to get off. So that's good, because you want to keep the wound as covered for as long as possible to create an environment underneath that promotes the growth of the new cells undisturbed, and hopefully when you do go to wash it off, you notice that you have that the wound has reduced in size. So you've got all of these products. We have all of these in stock. You may well find that you've got them in your first aid box. They do have a best before date, so it would be worth having a look and just double checking that. In particular, the tubs, obviously once they're open and you've put your hands in, if you've got any dirt or grime on your hands, you then don't want to be adding that a couple of months later to a new wound. So it might be that you need to update your first aid kit. And finally, you've got the dressings, which you can put onto your wound should you need to provide a physical barrier. So first of all, you have got the Skin Tact, which is a non-adherent dressing, and basically this is designed so that it will go against the wound and not leave any tissue fibres within the wound. It is also absorbent, so it will draw any excess moisture away from the wound. You've then got the natural Intex from NAF and the animal Intex, which is basically a poultice, but you can use these in 3 ways. So you can use them as a cold poultice, you can use them as a hot poultice, or you can use them as a dressing. They again have the absorbency and they also have the non-adherent side on them, so you can use those as a dressing as well.